Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, we're super excited to have you here because we're just having some excellent and amazing conversations with some fabulous leaders that are painstakingly reshaping the future of healthcare. We happen to be really passionate about a few different areas. We're passionate about leadership, access, innovation, and innovation adoption. If it's your first time tuning in, let me just tell you a little bit more about what we're trying to get done here. So, our focus is on bringing real stories of innovation to life, not just the stuff that you read about, stuff that's theorized, but those that are actually getting stuff done and highlighting these leaders and giving them the opportunity to share their story, their learnings with our community and ultimately with the world. And we've got an amazing action-packed year. If you haven't had the opportunity to check out any of our historical interviews, whether you're watching this or listening to this, wherever you are, however you're consuming this, make sure that you hit the subscribe button now so that any of the new interviews come directly to you. Now, if you've ever felt like the real innovation in healthcare is happening, outside of the boardroom and far from DC, this conversation that we're about to have today, you've been waiting for. So today's guest isn't really just poking holes in the broken economics of healthcare. He's actually rebuilding the model from scratch. So James Millaway is the CEO and co-founder of Zero Health. At a time when most benefit leaders are still playing by outdated rules, Jim and his team, they're rewriting an entirely new playbook, one that puts employers and their people back in control. So before launching Zero, Jim had spent years inside of the machine. He led benefit strategy from one of the largest integrated health systems in Oklahoma, helped shape a regional HMO, and played a key role in a brokerage that was later acquired. So along the way, he earned a few nods from Forbes as one of America's most innovative benefits leaders and Business Insurance as a top 40 consultant under 40. But what sets Jim apart isn't just the accolades. It's the clarity of his vision. Zero isn't just a platform. It's a philosophy. It's a system that's built around bundled payments, radical transparency, and $0 out of pocket costs for employees. Employers save, members win. And for once, healthcare behaves like a market actually that makes sense. So he's been featured in Cracking Healthcare Costs and the CEO's Guide to Restoring the American Dream. But none of that really fully captures the way Jim thinks. He's sharp, he's direct, and deeply principled. So, Jim, it's great to see you. Welcome to the show.
Hey, Michael, thank you so much. I'm excited to be here.
All right, so take me back to, I guess maybe like the first moment you knew that the system was broken, not intellectually, but like viscerally. What did you see and how did it hit you?
Wow, that's a great question. So my oldest son is 14 years old today. He was probably 3 or 4 and had a series of 5, 6, 7 ear infections, right? So the
Hmm.
pediatrician says it's time we got to do ear
Right.
tubes. And I understood how the system worked, right? I'd been at a large health system. I'd been at a large regional HMO. I was now sitting on the broker consultant side. And so I did what I wasn't supposed to do, which was book an appointment for my son to see an out-of-network physician.
Right.
And the reason I did that was I knew this out-of-network physician and this out-of-network facility, if I went there, would waive my copays, deductibles, and coinsurance. This was going to
Mm-hmm.
be free for me. So we went outside of network, had the procedure done, wild success, no more ear infection, kids healthy. The health plan got billed nearly $12,000 for that ear tube procedure.
Hmm.
It just so happened you could go direct to a provider in the same market with cash and get that procedure done for 1200. I just saw the absurdity of nearly 10x charges just the way the system was built.
Mm.
And that was really the eye-opening moment of there is a much more efficient way to purchase healthcare.
Yeah. I mean, because look, you've sat on every side of the table, right? Payer, provider, broker, employer. I mean, what's something that you understand now that you couldn't possibly, have grasped when you were really deep in it?
I don't think I've fully appreciated how efficient the system is at moving people to the highest cost setting as possible.
Mm,
Right? Leakage is a horrible word in health systems and plans. You want everyone trapped in the
right.
same ecosystem. And I don't think employers, I certainly didn't as a broker consultant, appreciate how efficient the machine was that I couldn't see of making sure that not only my employees, but people in my family were moved to higher
Yeah.
cost settings.
Yeah. Yeah. Do you, I'm just thinking that, do you remember the first time that someone told you, like, that'll never work? I mean, how did you respond and like what happened next?
Yeah, that's a great question. It seemed too straightforward, right? We go get direct contracts with a healthcare provider. We go talk to the
Right.
self-funded employer, and suddenly the transaction works. And the first time people said this won't work, right, was, well, what about the legacy incumbents? What about the large carriers? What about the large health systems, right? This is not how the world works in a traditional network scenario. And we said, no,
Mhm.
no, no, we understand that. We're going to sit beside it and just operate autonomously. And so it wasn't so much that people were poking holes in the mechanics of it, they just couldn't step back far enough to remove themselves from the everyday reality to understand that there was just a much more simpler way. And because it was so simple, it was very often confusing for people.
Mm. Do you feel like because it's so simple and because it's foreign to what most people consider, I'll say, typical or normal experience, do you feel like it's kind of like the body when it gets a foreign object and then it all of a sudden it sends things to sort of um, to fight off that new innovation? Did you see that happening early on as
Oh,
you
yeah,
and the
status
team were kind of
quo.
moving?
Yeah, status quo was comfortable, right, for the HR and financial buyer and employer, right?
Hmm. Hmm.
It wasn't overly comfortable, right? They were still looking at 12% increases that were being renegotiated down to 8%, right? So just the idea of compounding interest, right? These health plan costs were out of control, but the status quo still felt somewhat predictable, right? They knew
Hmm.
what to expect. There were typical players. You put these three pieces together, right? And you do what you can. And we were asking people to step outside of that, right? We were asking people to take control of the healthcare businesses that were running inside of their organizations when many
Yeah.
people didn't appreciate they were running healthcare businesses.
Mm. Was that experience with your son, was that sort of like the aha moment that, led you to sort of build zero the way that you did?
I got really lucky from a timing perspective. We have this procedure with my son where I had an unfair advantage, right? I knew how the economics worked. I really understood in network and out of network. I had relationships with the physicians. I had relationships with the CEO of the surgical hospital. And you step back from that and you
Yeah.
ask yourself, well, what on earth does a normal person do, right? People without that unfair advantage,
Yeah.
right? And those people walk down the hall and incur huge costs for the plan, but also huge costs in out of pocket. I say we were lucky because at the same time we were going through this, I had a dear friend named Paul Keeling, who at the time ran business development for another healthcare organization, CARE ATC, who does on-site
Hmm.
and near-site clinics. And he
Right.
said, my gosh, we have to go to Oklahoma City. And we drive to Oklahoma City, and I sit in a room with an absolute maniac. And I mean this as a term of endearment.
Yeah.
A
Yeah.
guy named Keith Smith, who's an anesthesiologist who runs the Surgery Center of Oklahoma.
Okay.
In an effort to compete, right, in a really muddy system where he knew he had better pricing and better outcomes,
Hmm.
he decided to just post all his prices online, right? So for the first time ever, a buyer could see what that ear tube procedure
Yeah.
would cost, what the ACL repair would cost. Coupled with the knowledge I had of what the plan paid and what I would have been
Hmm.
subject to with my son's ear tubes, we look at Keith's price, $1,200. So suddenly we have a real life seller in the marketplace. All we have to do is get him to the real life buyers, which are the self-funded plans. That was really the aha moment. And we were lucky to be in a situation where I had a need for a son, right? So, right in the midst of the economics of
Right.
it, but geographically, really lucky that Keith was only an hour and 20 minutes away from where I was sitting.
Yeah. 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 I'm even just thinking, like, how do you? how do you actually get a hospital or a surgery center to say yes to a bundled price, with full transparency? I mean, what does that conversation sound like?
Yeah. So it's an interesting conversation. And I can tell you from experience, and you and the listeners would know this, healthcare is still a largely localized phenomenon, right? So the three major health system players in Tulsa are unique to themselves in Tulsa, and that's different in Wichita and different in Dallas and different in Denver. The conversations are different too. The only thing that holds true market to market
Hmm.
is the bigger the building, the slower the process.
Mm.
So if I'm chasing the large dominant health system, this is not a
Yeah,
quick conversation. We're, in our experience, joint ventures with physicians at specialty hospitals, whether it be orthopedic or heart, physician-owned ASCs, family-owned imaging centers,
right.
regional dominant players that aggregate
Yeah.
ASCs are much faster.
Okay.
The conversation we're having with them is not, hey, thanks for picking up the phone. I need you to cut your rates 40%.
Hmm. Hmm.
It's explaining to them two things. One, these are much more attractive patients. These are commercially insured individuals.
Hmm.
They have no out of pocket, which means
Hmm.
you have no deductible, no copay, no coinsurance to chase, no AR,
Hmm.
right? There's no prior auth, pre-certification, insurancy stuff. So you've got no collections and you've got no overhead. And you can bill us just like you bill Blue Cross, right? Drop a claim
Hmm.
electronically to our payer ID. On top of that, and understanding that we're sending them the most attractive patients they could have, right, as close as they could get to cash equivalency,
Right.
we want them to understand that the status quo PPO network is giving them pricing they'll never realize. If you get 100 patients from that
Mm.
PPO, 10 of them are canceling, right, just because they can't afford the copays and deductibles. Another 15 of those are going to get denied by prior auth. Another people that get through there, 15 are going to get claim denials. You're going to spend money appealing those,
Hmm.
right? And then once you get to the very end, if you're really, really good, you're going to collect about 40% of that member out of pocket. So it's
Right.
this idea of revenue rot, where the dollar in legacy is not worth nearly the dollar in bundled payments.
Mm. You've said before that transparency is more dangerous than disruption in healthcare. Why?
The system is opaque by design, right? So we still struggle, even in a world of machine readable files. Like, how do you make sense of that, right? How do you
Mm.
understand the cost ahead of time? That's exacerbated by traditional fee for service payment, right? Where
Okay.
reimbursement is based on volume and not value.
Yeah.
It's an incredibly tough transition or pivot for legacy players to have to put prices based on value to the end buyer, and the end buyer being the self-funded employer and the self-funded employee and their family. And traditional revenue cycles weren't built to maximize value, right? Whether it's the
That's right.
EHR or the human beings, this is how do you maximize volume? So it's a complete paradigm shift, often in organizations who are dependent on the legacy reimbursement model.
Yeah. Yeah. That's fascinating. You most people they assume that patients won't change behavior, but you've seen the opposite. I mean,
Yeah.
what's a story that still surprises you about how people respond when the incentives finally make sense?
When we started the organization, so myself and my co-founder, Dr. Stan Schwartz, we got excited for two reasons. One, we thought financial buyers, right? So the CFO,
Yeah.
VP of finance would really like us because we could make this more efficient from a purchasing standpoint, right? Save a
Mhm.
bunch of money. We thought the HR buyers would really enjoy this because this was an incredible benefit for the employees.
Yeah.
We really underestimated the human impact this was going to have on the employees and the families that we served. So
Mm.
certainly waiving copays, deductibles, and coinsurance is a great incentive to change behavior, right?
Mhm.
Freeze the magic number. It's not your copay used to be 35 and now it's 28.
Yeah.
So make it easy to understand, but I still read as many as I can because we're, approaching nearly 200,000 active members today. I still read as many of the reviews I get from the employees and their family members. So
Yeah.
we survey everyone to track Net Promoter Score. And, Net Promoter Score is certainly something we're proud of at 94. What's
Which is
remarkable,
unheard of, by the way. Unheard
well,
of in healthcare. What is it? 70 something is, I mean, it's like an abysmal number. It's like,
it is
it's not great.
when we look at major health plans, they're so low, the data supports that people would rather call their cell phone carrier or the airline company. So it's often an abysmal experience. Free and the $0 out of pocket benefit certainly got people's interest. But once people use zero, the level of trust they have with us has just been remarkable. If you read these survey responses, it's fantastic, exceptional. I don't know what I'd do without you. And if you went and talked to our employer customers and they said, "Why do you work here?" and they get to benefits, the one benefit they call out
Yeah.
by name is generally always zero.
Hmm.
So
I
we've
go, let's,
humanized it. We've made this easy, right? No coinsurance, no copays, no deductibles, not waiting around for the insurance company to approve what you need to have done. But we've given people real life personal health assistance. And when people respond to these surveys, they talk about personal health assistance. I can't believe Devin was able to do this. I can't believe Chelsea was able to do this. And so I think the team as a whole have done a wonderful job of not just simplifying healthcare, but humanizing it.
that's right.
And we wake up as a name that people put a lot of trust in, and that's something that we don't take lightly.
Yeah. I mean, when you talk about promising zero out of pocket with, 30 to 50% savings for employers, I mean, that almost sounds like mythical.
Yeah.
I mean, walk us through a specific, case that actually, brought that to life.
Yeah. So, and it's not uncommon from the employer side, right, for us to
Hmm.
hear, "Oh, this is too good to be true." It's not uncommon from the employee side. "Well, I'm going to get this for free. This is too good to be true." So, when we started the organization and we continue to push heavy today on data and technology, in a world of healthcare, specifically self-funded for employers, people get all kinds of reports and all kinds of data. Unfortunately, none of that data tells anyone what to do. It's a scorecard of like, here's how bad it was the last 3 quarters.
Yeah.
So we approached it from a data standpoint to challenge ourselves and the team. How do we turn data into insight? How do we turn insight into suggested action? And how do we
Hmm.
turn suggested action into measurable impact? So over the years, we've built up a pretty sizable database that represents about 1.4 million unique patients and about 8 billion in plan spend. So
Hmm.
we know not only the frequency at which people would need ACL repairs or CT scans of the abdomen and pelvis, but what those are typically reimbursed at. We'll use that CT scan of the abdomen and pelvis, a 74177 for all those coding wonks out there, is typically reimbursed right after network discounts at about $1,400.
Hmm.
We can go get that virtually in any market in the United States between $325 and $350. It is not uncommon in advanced imaging where you see wild price variation with
Hmm.
that CT, MRI, ultrasound to see potential savings of anywhere from 60 to 80%. So you start to look at these things. Over the years, we've built an analytics platform that's really good at understanding opportunity, getting to suggested action and measurable impact. The human beings on our team, whether that's the data technical team or the clinical side, have spent nearly 4,000 hours
Yeah.
refining that data. And what we've been able to establish is what the fair price is for nearly 4,500 unique services and procedures. So to understand what the opportunity was, where the
Right.
arbitrage was, we had to build a data company way before we could build what we were today.
Fascinating. I love when you mentioned around suggested action and measurable outcome. Do you think about it from the patient purview, and do you also think about it from the employer purview? Does it differ in terms of what the measurable outcome is for both of them?
Yep. So we think about it on both fronts, right? So the employer needs to first understand what the opportunity is, right? Here's what you should do. Here's what the likely outcome is, and here's how we measure it over time.
Yes. Right.
They have to understand once they're here, right? We're 100% transparent with data, right? So an employer wants to see our fee schedule, the provider will email it to you, right? If you want to see on our funding requests, like claims and fees are separated, right? There are no hidden tricks in this business, no surprise fees or surprise bills. When we think about it from the employee side, everybody in the organization is obsessive about the member simplicity, right? So we'll make life
Right.
a little bit harder for employers than it needs to be, and a little bit harder for providers than it needs to be, and a little bit harder for the brokers and consultants than it needs to be if we think it improves the member experience. And when you run an organization, right, top to bottom, left to right, through that lens, then you can deliver employee experiences that deliver 94 net promoter scores. And so we think about that suggested action. We want to be the trusted entity to, when you need scheduled care,
Hmm.
talk
Hmm.
to a personal health assistant. We've done all the heavy lifting and building the network
Yeah.
and qualifying outcomes. We want to be the easy button for the employee and their family member. And I think most importantly, and this goes back to suggested action to the employer side, is financial barriers to care are often, if not always, the number one barrier to care.
That's right.
People delay, forego, and skip high value care, often at a rate much higher than unnecessary care.
Mm.
When we remove those financial barriers, of course, we can deliver an incredible employee experience, but the data supports the notion that removing financial barriers improves not only financial outcomes, but also health outcomes.
And just knowing that, why do we continue to kind of shoot ourselves in the foot if we know that that data is so clear? Is it because the system is built to reward other actions aside from that?
Oh, it is. So again, the system is built to reward volume, not value, right? On top of that, people often people often talk about how the system is broken.
Yeah.
The system's not broken, not remotely. The system is beautifully designed, right? The system is just not designed for the outcomes that most favor me and you, the
Right.
employer and the employees that we serve. This is a tremendously large industry with tremendous sway and tremendous influence. Status quo remains incredibly powerful, and status quo is actually preserved by FUD, right? FUD, fear, uncertainty, and doubt. Well, don't do this because this is a startup. Well, their pricing can't really be better.
Right.
Well, they
Right.
really can't execute. And you touched on it in your intro. The most important thing for employers, their broker consultants to understand is the cavalry ain't coming from DC to fix this problem.
That's right.
Right? True healthcare transformation will happen employer by employer and
Mm.
community by community. And we're attempting to play our little part in that role of what a next generation benefits
Mm.
looks like.
That is going to be a quote. True healthcare transformation is going to happen employer by employer and community by community. Totally. Uh, if I pulled your team aside and asked, hey, what's one thing that Jim always sort of pushes you guys to do, even if it's uncomfortable? What would they say?
Always over index on member experience, right? Always absorb complexity.
Mm.
How do we improve the experience, certainly for the member, but for all the stakeholders that we hold, right? So whether that's an employer, whether that's a provider, whether that's a broker consultant or the members, the team would tell you that we have this obsession over radical simplicity.
Mm. All right, fun question. Maybe we just say you get a call from DC, right? Because we mentioned that earlier, and you get a call from HHS tomorrow. and they handed you the rein for 48 hours. What's the first thing you do? Knowing that the clock was ticking.
I'd ask for all the data, right? Data is key to this, right? Like, how can we make employers and their broker consultants much better purchasers of healthcare? How can we help providers optimize supply side of the marketplace? And when those things are humming, what does the data tell us that we need to focus on to have the biggest impact on the people in this country that rely on either employer-sponsored health insurance,
Hmm.
coverage from the exchanges, Medicare, Medicaid, TRICARE? It's let me see the data so we really understand what's going on. And once we understand what's going on in a way that we can clearly articulate suggested impact of the employer, right?
Hmm.
Suddenly the world's a different place.
Totally. I know you've been a foundational part of Health Rosetta, and you kind of helped draft the 95 theses. Curious which one still gives you goosebumps and why?
You know, I was involved with Dave Chase and Health Rosetta from the very early on. I'm excited to go back. I'll be at Rosetta Fest in a couple of weeks for my first time in a couple of years. I don't think there was any one specific thing in that 95 theses that stood out to me more than the other because I think they were critically important. The exercise of playing a small part in help building those
Yeah.
was certainly incredible and a great learning opportunity. I think the thing that always has stood out to me
Mm,
when you think about the opportunity of Health Rosetta and what it's meant to do and the impact it's meant to
mm,
deliver to the communities in the United States, and Dave Chase has said this repeatedly, the fixes to healthcare already exist. How
hmm.
do we scale those?
Yeah.
And I think Dave Chase is probably the most remarkable evangelist in this space of helping people not only understand that, but he's a remarkable storyteller.
Right.
So all this can be fixed. How do we scale these fixes? And
Mm.
that's one thing that's always stuck with me.
Yeah. I mean, look, the truth is that most employers they still feel trapped.
Yes.
Like cost is inevitable. I mean, what would you say to a CEO or a CFO right now who's kind of silently nodding along, but like maybe they're terrified to make a change.
Benefits are one of the easier things, regardless of the financial impact for a CEO, a CFO, even oftentimes a CHRO to say, well, we have people on the team that do benefits, right? And so that's being not necessarily decisions made at the executive level. The story that we're telling to the CEO, CFO, and CHRO buyer is we understand that, but we
Mhm.
also understand that benefits are the clearest cultural signal you can send to your employees.
Hmm.
Right? The CEO is certainly the keeper of culture in all organizations.
Right.
It's rather contradictory to say we do everything to support our people,
Hmm.
and then when people need you the most, you stick them with $5,000 bills for an MRI. So let us help find and show you a much more efficient way. And we honestly believe, and our customers would tell you, that this is likely the most tangible articulation of your culture and action that
Hmm.
you could possibly do when you think about protecting your people in their most vulnerable times.
Yeah, fascinating. I mean, you mentioned just benefits reinforce culture, or they could be completely contrarian. It's like, oh, we're this, and this. It's like you're not because you just stuffed your employee that's been working day and night with a $5,000 bill, and it puts them into a whole heap of financial trouble. So it's like, what are you actually saying? What are you really saying? Curious. I mean, what have you learned about um, just courage from employers who said yes to zero? Because it does take courage to kind of go from the leap from what everyone thinks is traditional and typical to this methodology?
Yeah. So you certainly want to find early adopters, right? People that are innovative in their businesses to begin with, right? You have to build credibility in the marketplace, and having no logos is a lot harder to sell when you have 25 logos in that same either geography or industry.
Hmm.
One of the most powerful things that we've been able to communicate to the CEO, CFO, and HR buyer is from a Journal of the American Medical Association article all the way back in 2014, titled The Anatomy of Healthcare in the United States. We're essentially the authors of this paper. We're asking what in the hell happened between 2000 and 2010, right? How do you see this just
Yeah.
excessive growth in cost? We're taught that the culprits behind that are unnecessary procedures, right? Overutilization. People aren't, people are overweight, right? People consume too much healthcare. What that JAMA article found was that 91% of cost increases could be
Hmm.
attributed to price increases alone. So there was no
Fascinating.
way to Fitbit your way at 10,000 steps to beat the system that was raising your MRI price from 300 to 600, from 600 to 800, from 800 to 3,000. So once employers understand, right, there's this wildly efficient system to move your people to the highest cost setting. And on
Hmm.
top of that, like this is all being driven by price, we start to see people act with more urgency.
I mean, I feel like the way you're talking, it's like you've done your fair share of battles with the status quo. I mean, but uh, for example, like when your kids ask you, "Hey, Dad, what did you really do?" How do you want to answer that?
That's a wonderful question. And I'd like my kids to understand at the end of the day, hopefully I made healthcare more affordable, more accessible, and profoundly more human.
Hmm. What's the best way that people can continue to sort of follow the Zero story? Where can they get updates? How can they sort of get hold of you and the team?
Yeah. So the best resource is our website at zero.health. Please follow us on LinkedIn. But this is a beyond dedicated and beyond passionate team. We welcome any conversation, and not everything's going to be a fit, but I'm confident we learn in each interaction, whether that's a provider, an employer, or a broker consultant.
Hmm. All right, so last one. So, I mean, if the next generation of sort of health entrepreneurs is listening right now, I guess what's that one mindset shift that they must take before they build?
The one mindset for a new entrepreneur entering this space.
Yeah, they got to take before they build. The shift they got to
The
take.
most important, I think, in my perspective, to understand is if this was easy, everyone would be doing it. This is,
That's
this is an
true.
incredibly difficult space to attack, and the space being defined as employer-sponsored health benefits. This requires incredible persistency and some level of a mental health disorder, right? You have to be ready to be told no and no and no and no and no repeatedly, but somehow know that when you do break through, the impact will not just be bigger than you or bigger than the organization within which you work, but bigger than any other impact you probably could have had when you think about
Hmm.
technology and what startups can do to impact the communities we live in.
Amazing. Yeah, listen, for those that are tuning in, if you were listening to this, if you walked away thinking differently about how healthcare ought to work, that's the point. You know, Jim, you didn't just challenge the system, you invited us to imagine what's possible, when alignment, transparency, and even courage sort of sit at the center. It's easy to accept complexity, as the cost of doing business in healthcare. But this conversation reminded me that simplicity is often the most disruptive force of all. and especially when it's built around people. So if today's conversation moved you, you're listening to this, if it challenged you, or if it made you think differently, share the episode, share it with a friend, share it with your network. And if there's a topic that you want us to explore, or if you're a leader, if there's a leader out there rather that you want to hear from, drop me a note, leave us a comment. I do actually read them. And remember, this platform isn't just about content, it's about community. And if you want to get stuff done, you got to do it together. And for that, thanks for listening. Keep building with purpose. And we'll see you on the next time in the Advancing Healthcare Innovation Show. Thanks for joining us, Jim.
Thank you.